Is it safe to attend a sporting event during the pandemic? Well, we had the opportunity to speak to Dr. Anthony Harris, the Director of Workforce, who tells us about all the safety measures you should look out for before attending an event. This interview is brought to you by our good friends of Manscaped. Make sure you visit manscaped.com. Coming up next, Dr. Anthony Harris. Welcome everyone to a great interview here with Dr. Anthony Harris. He is with the Medical Director at WorkCare. Dr. Harris, thank you so very much for your time and speaking to us here on the Roman Show. Really appreciate it. I understand that you've been very busy these days with this whole COVID-19 and the numbers spiking every day, especially here where we live in Florida, but across the nation. But Doctor, thanks so much for your time to speak to us.
Hey, Mr. Roman, pleasure to be here, and happy to have a great discussion on how to help.
Well, let's first get to the case. Get straight to the point. Actually, this week, Walt Disney World opened up their doors to the public. Prior to that, though, Universal Studios had opened up their doors as well. And you've been a part of this. What can you tell us so far? I understand, and correct me if I'm wrong. You're the doctor here. I understand that we really don't get to see any spike numbers until 2 weeks this whole thing happens. Is that accurate?
Yeah, I mean, there is going to be a lag, in terms of when social distancing breaks down and when we see spikes, right? And that's at the end of the day, that's what it's all about. And when we talk and when we're counseling with theme parks and those venues that have the public coming in, the name of the game is really to get people to adhere to the protocols in place. Is there a safe way to open up and prevent transmission of COVID-19? The answer is unequivocally yes. And we can talk further about what those, protocols look like. But, the quintessential part of it is getting the general public to adhere to those protocols when they are in place.
Moving forward, Doctor, now we're moving into this. There were some talks, some conversations that when the heat was coming in, it was going to help kill the virus. What have we learned so far about this?
Absolutely not true, right? What we know about this particular virus, SARS-CoV-2, and its vulnerability to sunlight, if you would, or heat, it really is vulnerable to UVC. UVC being from the sun, but the UVC that we get here at the ground level is very minimal. Most of the UVC is filtered out by the layers of atmosphere above us. So, the notion that summertime is going to bring more intense sun, more intense heat, and be able to kill the virus, just not playing out that way, and not what we see when we examine at the level of studying the virus and its susceptibility. Now, with that being said, one of the trends that we're probably seeing in regards to why spikes are happening is because people are out and about, right? Mm-hmm. Before we were social distancing because of measures in place. Now that the summer is in full swing, people are anxious to get out. And, they perhaps have swung too far to the left in regards to getting out and about in social spaces without those measures being adhered to well. And so there's a way back, and we can talk more about how that looks, but certainly summertime didn't bring the cessation of cases that we had hoped.
There was a report recently, or a doctor came on the press and stated that if everyone wore their masks for I guess 2 months or something like that, it was about 2 months, the virus will pretty much just be abolished. Is there any truth to that?
There is some validity to that statement in that, these measures that are in place, like wearing a face cover, are designed to help minimize transmission from one person to the next, right? And with regard to the face covering, the whole goal of the face covering is to stop those droplets that are expelled when we're talking or speaking or even singing in some cases, right? And those droplets, most of those droplets are about 20 microns in size. and those fall to the ground within usually 3 feet, studies show. But it's those droplets that are about 5 microns in size or smaller that can hang out in the air. And so we know that a cloth mask that is at least more than one layer of cloth is effective at preventing most of those droplets from being pushed into the air when we're around and speaking and congregating with others. Obviously, that social distancing piece is also key to stay out of that zone, if you would, where those droplets hang out around each of us. But there is validity to the notion that face coverings will be key to helping stem the tide of this resurgence we're seeing.
And Doctor, again, thank you so much for taking your time and speaking to us. Really appreciate you with all your knowledge. We're speaking to Dr. Anthony Harris, Medical Director at WorkCare. So, speaking to you, I get the gist. Hey, it's not that bad going to Disney World as long as we're practicing the social distancing and we're wearing our face mask. But when it comes to sporting events, we sure as hell miss our sports. And as you know, sporting events, some of them are held in arenas or in venues like banquet halls or whatnot. Not particularly in a large stadium, but in relation here for some sports such as pro wrestling or mixed martial arts or boxing. In these type of events, Doctor, as you know, there's a lot of excitement. There's also drinking, right? There's beer drinking and or food or whatnot that you're eating. But with the excitement comes the standing up and cheering. And when you cheer, you are more than often, you're going to be some saliva, right? Some droplets are going to be in the air. So is it safe to hold an event with fans and practicing the social, even if you have that 6 feet apart? And I've seen in some events that they've held, like in gymnasiums, the seats are 6 feet apart, but you'll have like 3 seats together, then you have the 6 feet. But you still have people screaming and cheering.
Yeah, and you're right. You're absolutely right. And when we talk about, perhaps the worst case scenario in terms of potential exposure, right? We're talking about these venues where people are gathered together and there's a lot of excitement, right? Take, for example, the notion of what's called super spreaders or super spreading events. These are classically events where, again, like in a church, you have a bunch of people together and they're celebratory, if you would, and there's a lot of vocal opportunities for people to spread the potential virus. So these things we know to be bad, right? Just flat out bad in terms of risk for transmission. Now, if we're taking into account that when you show up to these events, everyone is adherent to the process of protecting others, wearing the face mask, that will be, useful in decreasing potential risk. But still, there's risk there. Nothing's absolute, unfortunately, right? Everything is kind of a gradient of risk. And taking these measures, each measure is designed to decrease risk further. Washing your hands frequently, the social distancing, the face mask. So these things absolutely have to be in place, even in those venues, especially in those venues where you're indoors and there's limited airflow as opposed to out in a major field. But I definitely understand and feel, the urgency to re-enter the sports opportunity for entertainment, right? My niece plays D1 softball at Duke, and my nephew coaches D1 basketball in Tennessee. And, they're itching to get back, but we have to make sure we're doing it safely to protect everyone.
So if we're in a venue and everyone has their mask and we scream, of course, nothing is guaranteed, but with the probability of us getting COVID-19 or less, because everyone is practicing what they should be. As far as the face mask and, of course, the social distancing.
Absolutely. As far as we know, that's going to be the best case scenario to minimize the risks to others and be able to open back up safely. Absolutely. And
now, see one thing that and I see here as a challenge is, take, for example, pro wrestling. You have these pro wrestlers that are inside the ring, and they're used to engaging with the crowd. They're shaking hands. And it's so hard for them to see these fans with face masks, and you're not able to touch them because it's just something that's a part of the sport. So it really just comes down to education.
It certainly does. Education and behavior modification, right? You can put it out there in terms of what to do and how to do it, but at the end of the day, if the fans aren't knowledgeable, the patients aren't knowledgeable, and they're not adhering to those protocols, then the efforts break down and the usefulness of those efforts break down. And so I agree with you wholeheartedly. Education is going to be key. And, education is coming from a myriad of sources, not just operations like ourselves and at WorkCare, a group of occupational health docs, but the local and community hospitals, the local county health departments, the communications coming from there are going to be key and essential as well in terms of getting the public, on the same page of we're here to help protect each other and do the best we can to reopen safely.
So, Doctor, when can we feel pretty confident? I know the vaccine there, as far as my understanding, I believe it just hit the first phase going into the second and then soon the third phase. Correct me if I'm wrong there. But when can we feel safe to go to a sporting event, hell, even a family gathering, and just feel like, hey, we're okay. We don't have to be worried about this COVID-19. But one thing I could tell you, though, Doc, I think that now people are learning their lesson to always wash their hands and not touch their face no matter what, despite this, right? I think we took that from this.
I agree with you. People are starting to become more cognizant, right, of are they practicing safe, practices in regards to hand washing, not touching the face, wearing the face mask. And in regards to, when it's going to be safe for us, it's going to be really a case-by-case scenario. Take, for example, what we're seeing play out in various states. You have various states in different levels of being open for business, restaurants being open for business, and you're seeing a drastic difference in what obviously is being experienced in Florida versus being experienced perhaps here in Illinois and Chicago, where I live, because you have measures in place that are designed to help protect. And so we know that, it can be safe to go back into the sporting events, but you're going to have to be really keyed into the particulars of that event, right? And just, pay attention, right? If you show up and you're not seeing protocols adhered to in the crowd, consider leaving, right? And I know it'd be hard for many after you've already paid your admission and you've arrived, but we do have to be cautious on a case-by-case basis, event-by-event basis, as to whether or not it's going to be safe for you and safe for your family to be there.
So, and Doc, some people are just claiming victory. Once we get the vaccine, everything's back to normal. I don't think that's the case, right? It would take a process, and who would, in your opinion, who would be the first in line here that will be getting this vaccine? I don't think it's going to be like a free-for-all, like a buffet. I could just show up and get vaccines, How would that work?
Yeah, you're spot on, right? Just having the vaccine available is just the first step in the whole process of getting the general public vaccinated to the level that is required for what's called herd immunity, right? And herd immunity being that we have enough people vaccinated, enough people immune to the virus, SARS-CoV-2, that transmission rates dramatically drop and hopefully eventually go away. That number lives around, depending on the geographics, is around 60%, right? 60, sometimes 65, 70%. And the logistics, step two of getting that vaccine once available out to the general public and starting to vaccinate as many people as we can is the next big hurdle. And even, the CDC is working, has special dedicated funds with NIH to address how logistics are going to work once a vaccine is in play. And there's hope, right? The efforts, particularly a vaccine that's in phase 3 clinical trials in association with the federal government, agencies, and Oxford University is launching in Brazil. It's throughout the UK. It's in a number of locations in that last stage of approval, if you would, FDA approval. And once we have it, though, it's probably still going to be well into 2021 before we get to that point where we have herd immunity. But we're ramping up. 300 million vaccines, vials of vaccines is what the target is for October from this particular opportunity with the Oxford collaboration.
So you're saying that maybe potentially, let's say, if the vaccine drops in the fall, we could be somewhat people obtaining this vaccine, say, late next year?
Well, actually, Actually, October is the earliest anticipated. Beginning of next year, early next year is what may be more likely. And then the point at which we have wide distribution, well into next summer or even next fall, because of the logistics of getting, that scale of a vaccination effort is just tremendous. One can imagine. So it will be some time till we get to that 60-70% herd immunity level.
So that good 2-year window seems kind of like we'll somewhat be back to this new normal per se.
Hopefully so. Yeah. Once we start having communities, and it will be case by case, right? Most likely, the highest risk areas, the most vulnerable people will be the ones that receive it first, right? The elderly, those who have pre-existing conditions, et cetera. So there'll be a game book in terms of distributing the vaccine to make sure we're capturing the risk for those who are most at risk of dying from COVID-19.
And in the fall, Doctor, there's also been said that the numbers are expected to increase. Will we see potentially that increase? But again, I guess it would have to go back to educating. If people are following the protocol, we won't see that number rise.
Well, across the board, we're anticipating a rise. If you look at the 23 projections that were given to the CDC just this week from different institutions and universities, including Columbia University, one of my favorite models for projecting out growth of the potential transmission across the country, they are estimating those 23 projections are estimating a increase in fatalities, of mortality of COVID-19 to 160,000, right? We're currently at about 135,000 deaths in the U.S., but by August 1st is anticipated of 160,000. So that's a dramatic increase, 25,000 more deaths from today until August 1st. In comparison, over the last week, we've had an increase of about 5,000. And in 2 weeks, we're going to have an increase of 25,000. So we're needing to really buckle down and get on top of our P's and Q's, so to speak, in terms of adhering to those protocols to help prevent these increases.
But doctor, even though the folks who are infected with the virus, that number, of course, is going up, but the deaths are low. Is that a good sign?
Well, so we're still seeing a correlation between, increasing, the number of deaths are increasing. The rate of deaths, we had a little bump about 2 weeks ago. The rate is starting to decrease still. And that could speak towards, and to your point, be a good sign as compared to our preparedness, right? We're learning more and more in the healthcare community of how to care for people once infected with COVID-19 to help prevent deaths. And we've learned a lot, I would gather as well, from overseas in countries that have been dealing with COVID-19 and have far lower mortality rates than we do here in the U.S. And the other component of it as well is that we're seeing perhaps a shift in the number of individuals affected in the younger generations. Those individuals less likely to succumb to COVID-19 infections. That could also be playing out as well in terms of what we're seeing with the decreasing mortality rate.
Well, Doctor, I think we've learned a lot from you, and I appreciate. We'd love to have you here again later on, hopefully in the fall, to see how things happen. I know many people are excited. They want their football back. They want all their sporting events. I know we got the NBA coming back and Major League Baseball and hockey, but with no fans. So it's definitely a different world that we are living in, and maybe some time. Concerts, for the most part, everything has been shut down. Across the nation, there are no musical concerts you can go to. I guess it just comes out to being patient, huh, Doc?
You're right. Patience is going to be key, but then also caution, right? Taking an abundance of caution. When you do have an opportunity to enjoy some of these opportunities of normalcy, go to an event, make sure you're just adhering to the precautions that the venue has put in place so that you're safe, so that everyone around you is safe. And that's going to play out for us far better at achieving that sense of normalcy, getting back to those things we have come to enjoy here in the South, the Midwest, the West, and abroad.
Well, Dr. Harris with the medical director at WorkCare, we appreciate your time. Thank you for your knowledge. Thank you for helping us stay clean and healthy with your messages here. We appreciate you, and keep doing what you're doing. We really appreciate all the work you do, sir.
Hey, Rodolfo, this has been a pleasure, and I'd love to come back, and hopefully we'll be talking about the success that we've had at stemming the tide in the fall. Thanks so much.
I can't wait to the moment till I go to a football game and enjoy a cold one. You know, Doc, I'm just counting the days whenever that happens.
I'll cheers to that.
There we go. Thank you, Doc. Appreciate your time.